I would like to invite our next foreign delegate, Hafiz Shoaib Ahmed from Afghanistan, to share his views.
Bismillahir-Rahmanir-Rahim. Ladies and gentlemen and dear friends, Assalamu alaikum wa rahmatullahi wa barakatuh. Today I'm here to talk about something really important, pneumonia. It's a big word for a serious problem, especially for kids in South Asia. Pneumonia is a disease that affects our lungs. It makes it hard to breathe and can make us very sick. Sadly, it's one of the biggest reasons why many kids, especially in South Asia, get sick and even lose their lives. But don't worry, because there's hope. We have the power to change things with the help from all around the world. So what can we do? First, we need to focus on preventing pneumonia. That means making sure we have clean water to drink, healthy food to eat. Breastfeeding also helps to protect babies from getting sick. Next, we can get vaccinated. Vaccines are like superheroes. They help our babies fight off bad germs that causes pneumonia. Making sure everyone gets their vaccine can really help stop pneumonia from spreading. We also need to make sure that when somebody does get sick, they can get the right help fast. That means having good hospitals and clinics nearby with doctors and nurses who have the knowledge to treat pneumonia. Pneumonia in Afghanistan. According to a research paper published in 2017, in Afghanistan, childhood deaths from pneumonia are high. According to the statistical findings, among 639 children at one hospital, the case fatality rate was 12.1%, and 46.8% of pneumococcal serotypes detected were covered by the 13-valent vaccine. Most deaths occurred within 2 days of hospitalization. Newborns and malnourished children were at risk. Vaccination could reduce pneumonia and save lives. Although the Afghan government is trying to eradicate the disease shortly, but getting rid of pneumonia in Afghanistan needs help from nearby countries like Pakistan and Iran and from all around the world. Pakistan can give direct help and also make it easier to transport aid and supplies to reach Afghanistan. Plus, Pakistan has experience in building hospitals and controlling diseases, which can be super helpful for Afghanistan. The rest of the world also needs to pitch in to tackle pneumonia in Afghanistan by collaborating with the Afghan government. This means donating money, medical stuff, and giving knowledge to make healthcare better. We need to make sure there's clean water, healthy food to eat, and more kids get their shots to prevent pneumonia. Working together with groups like NGOs and countries that help out can fill in the gaps and make sure resources are used well. We also need to look at everything that causes pneumonia, not just the disease itself, but teaching people about staying clean, breastfeeding babies, and getting vaccinated, not just in Afghanistan, but also in places like Pakistan and other parts of the world. Making sure there are good clinics, trained doctors, and enough medicine is also super important. By teaming up with neighbors and the global community and using smart plans, we can fight pneumonia in Afghanistan and make sure all kids stay healthy and happy. Walaikum salam wa rahmatullahi wa barakatuh.
Thank you, Hafiz Shoaib Ahmed. Now, I request Hurriyan Shahid from Learn to Learn Academy, Karachi, to deliver her speech.
Alaikum. My name is Ranchad and I am from Learn to Learn Academy Grade 6. Today on World Health Day, we gather to discuss a fundamental human right. The right to health is crucial because millions of people worldwide are struggling to maintain their health. Diseases, disaster, and conflicts are all barrier to achieving this basic human need. But here's the thing, everyone should have the right to be healthy. This year, theme My Health, My Right emphasizes that every individual, regardless of their circumstances, deserves access to essential healthcare services, clean water, nutritious food, and a safe environment. However, despite international recognition of health as a human right, many people still lack access to these basic necessities. This disparity is especially evident in places like Gaza, where a devastating war has been raging for over 3 months. Imagine they are born into such chaos. Nearly 20,000 babies have entered the world amidst the conflict, facing unimaginable challenges from their first moment of life. As stated in Article 37 of the United Nations Convention on the Rights of the Child, UNICEF. No child shall be subjected to torture or other cruel, inhuman, or degrading treatments or punishment, neither capital punishment nor life imprisonment, without the possibility of release shall be. Additionally, Article 38 underscores the obligation to uphold rules of international humanitarian law during armed conflicts, particularly regarding the protection of children. It's heart-wrenching to hear about mothers bleeding to the death and newborns suffering due to atrocities of war. Becoming a parent should be a joyous occasion, but for many families it's a nightmare. So what can we do about it? We can remain silent. We must advocate for change. We need to urge our leaders to prioritize the health and well-being of all individuals, including those born into conflict zones. We must demand that hospitals and medical resources be made accessible to everyone irrespective of their circumstances. But our responsibility doesn't end there. We must also address broader issues such as access to clean air and water, safe housing, and quality education, all of which play vital roles in determining our overall health and well-being. Despite being young, we have the power to make a difference, but it's raising awareness, fundraising for humanitarian aid, or advocating for policy changes. Every action counts. So let's make a pledge. Today, let's promise to be the voice for those who cannot speak for themselves. Let's commit to working together to ensure that every individual, regardless of their background or location, can enjoy the basic human right to health. Because together we can turn "I health, my right" from slogan to a reality.
Thank you, Nurin Shahid, for your speech. Government and policymakers must prioritize investments in healthcare infrastructure, workforce development, and healthcare awareness. The policies should be designed to eliminate barriers to healthcare access. I would like to call Nazia Khan from SOS Children's Village School, Quetta, to share her views with us.
My health, my right. My name is Nazia Khan and I am from SOS Children Village, Koita. Ladies and gentlemen, good morning everyone. I am honored to address you on this day about the health. This topic is close to my heart. The fundamental right of health is for everyone regardless of their background and financial standing. Access to a good healthcare system should not be a luxury only for a privileged class, but instead for each and everyone. Every human being has a right to lead a healthy life. Unfortunately, the reality is far from ideal. Most of the developing world's population does not have access to good healthcare system. Even if there are good doctors, nurses, and other healthcare professionals working in a hospital, this is primarily due to financial constraints, thus preventing them from seeking medical attentions. Without proper medical treatment, this often becomes the cause of loss of life. Additionally, together we can strive forward for health justice, imagining a world where success to equality healthcare is for everyone and it's not determined by social, economic, and geographical location. Furthermore, standing in solidarity of those who are marginalized and disadvantaged of element those constraints they hinder their access to healthcare system. Thank you.
Thank you, Nazia Khan. The theme My Health, My Right serves for promoting health as a fundamental human right and empowering individuals to assert control over their own health and well-being. Laiba Raza from Hamdard Village School, Karachi, please proceed for sharing your views. She will speak in Urdu language.
मोज़िज़ हाज़रीन कराम, अस्सलामु अलैकुम। आज सेहत कॉन्फ्रेंस का मौजू है मेरी सेहत मेरा हक। जनाबे वाला, सेहत का मतलब महज बीमारी की अदम मौजूदगी नहीं, बल्कि किसी भी फर्द का जिस्मानी, जहनी और समाजी तौर पर मुकम्मल होना ही दरअसल सेहत है। और ये तभी मुमकिन है जब हर फर्द को بلا تفریق مذہب و ملت سستی طبی سہولتیں میسر ہوں. فی زمانہ ہر سطح پر صحت کی بنیادی سہولتوں کی فراہمی کے لیے مضبوط نظام صحت رائج کرنا ناگزیر ہو گیا ہے. یہ صحت پر سب کا حق ہے اور یہ حکومت کے فرائض میں شامل ہے. معزز سامعین کرام، ہمارا جسم، روح، ذہن اور سمجھ آپس میں مربوط ہیں اور اسی ارتباط کی متوازن کیفیت صحت ہے. اچھی صحت ہم سب کا بنیادی حق ہے. یہاں یہ بات بھی قابل ذکر ہے کہ ذہنی صحت کے ضمن میں کچھ مسائل معاشرے کے منفی رویوں اور بیجا تنقید سے بھی جنم لیتے ہیں. یہ ہم سب کا حق ہے کہ ہمارے گھر اور معاشرے کا ماحول صحت مند ہو. اگر ہمیں یہ حق میسر نہ ہو تو صحت کی نعمت سے محروم شخص اپنی ذاتی قوت و صلاحیت کے استعمال سے معاشرے کی فلاح کے لیے خدمات انجام دینے کے قابل نہیں ہوتا. یہ ایسی محرومی ہے جس کا اثر فرد و جماعت کی ظاہر و باطن پر یکساں مرتب ہوتا ہے. صحت کا فقدان صرف جسم ہی نہیں بلکہ دل و دماغ، خیالات و افکار، اعمال و افعال سب کو متاثر کرتا ہے. جناب اعلیٰ، میری صحت میرا حق وہ الفاظ ہیں جو انسانی جدوجہد اور معاشرتی ترتیبات میں صحت کی اہمیت پر زور دیتے ہیں. اس عنوان نے ہمیں یقین دلایا ہے کہ صحت ہر فرد کا بنیادی حق ہے اور ہر شخص کو اس حق سے مستفید ہونا چاہیے. یہ عنوان مختلف پہلوؤں پر مبنی ہے، جیسے صحت کی اہمیت، صحت کی حفاظت کے اصول، اچھی غذائیں، روزانہ کی مشغولیات وغیرہ. صحت معاشرتی سلامتی کا عنصر ہے جو افراد کو مضبوط اور اقوام کو ترقی یافتہ بناتی ہے. صحت کا حق بلا تفریق مذہب و ملت معاشرے کے ہر فرد کو میسر ہو تاکہ معاشرتی نظام برابری اور انصاف کی راہوں پر چل سکے. جناب والا، میری صحت میرا حق ایک ایسی سچائی ہے جو انسان کو اپنی زندگی خوشیوں سے بھر دینے کا حق فراہم کرتی ہے. یہ حق صحت سے متعلق دیگر انسانی حقوق مثلاً خوراک کا حق، صاف پانی کا حق، آلودگی سے پاک ماحول کا حق سے متصل ہے. صحت کے حق کے تصور کو بین الاقوامی معاہدوں میں مرتب کیا گیا ہے. حکومتیں تمام افراد کو مناسب تعلیم، رہائش، خوراک اور کام کرنے کے لیے سازگار حالات کا حق دینے کی پابند ہیں اور یہ تمام حقوق دینے سے بہترین صلاحیتوں کے حامل افراد اور پھر ان افراد سے ایک بہترین معاشرہ تشکیل پا سکتا ہے. شکریہ.
Thank you, Laiba Raza, for sharing your views. Our next speaker is Zaid Ahmed Qureshi from Frontier Model School Boys, Peshawar.
Thank you. Honorable Chief Guest, Pakistan Hamdard Foundation, respected Sadia Rashid Sahiba, all honorable guests and non-Hal fellows. Assalamu alaikum. I am Zaid Ahmed. I am very thankful to be part of 32nd Hamdard International Children Conference titled as My Health, My Rights. Dear audience, the author of the famous book, Roberto Kiyosaki, once said, "Don't work for the money, let the money work for you." I will also share Gandhi's famous quote, "It is the health that is the real wealth, and not the pieces of gold and silver." Mr. President, those quotes have forced me to think deeply that in our pursuit to attain comfort in life, we often sacrifice good health, and such comforts are meaningless in the absence of good health. Health is the state of well-being and vitality of one's body. Life without good health is nothing. For maintaining a sound health, all organs of the body need to be functioning well. Mr. President, I would like to mention a famous quote here. I have learned to seek my happiness by limiting my desire rather than attempting to satisfy them. It is the foremost duty of every human being that he should prefer good health over each and everything, because only with good health he can face the challenges of life. We are all well aware of the fact that a sound body has a sound mind. The above fact shows that a sound health has significant impact on our body, and we are fully aware of its power. We should never compromise on good health. Dear audience, now the question arises, if all of us are well aware about the importance of good health, then why most of the people are affected by health hazard? I thought deeply to uncover the reason. At last I realized that health problems we are facing nowadays is the result of our disrupted lifestyle. Mr. President, the first reason is when we started living against the nature. The health started to decline rapidly. The natural food, which are full of nutrients, are replaced by the fast food. Moreover, their production is against the principle of health and hygiene, and the most alarming thing is that the children and grown-ups are so much attracted by this fast food that they prefer them over the most hygienic food being prepared at home. Cold drinks have also become the most important part of our life. Rapidly spreading air and water pollution have also become a serious health hazard. Mr. President, physical fitness is the most important factor for good health. Physical exercise brings you many benefits besides the healthier body. It also helps to stabilize our cognition and memory. But unfortunately, our life has become machinized. We walk less and are habitual of using cars and bikes. Our bodies are addicted to such facilities. But in return, diseases like blood pressure, diabetes, and other serious health issues are silently transferred into our bodies. The secret of long life and good health lies in the moderate way of living, which gives comfort to the heart. Simplicity gives comfort to the heart, satisfaction to the heart, while hotness, ostentation, arrogance, and pride destroy the comfort of heart. Dear audience, healthful youth is a healthful Pakistan. If we want to see a healthful Pakistan, then our youth need to adopt a healthier lifestyle. Those who adhere the principle of good health are less likely to encounter the health issues. We need to start a strong campaign across the company to ensure the health of all the people. Thus, for healthier life, pure thinking, smooth environment, simple ways of living, and light entertainment are absolutely essential. May Allah Almighty give us the power to play our part in it. Ameen. Thanks.